A warm welcome to you, dear students, for this presentation. The program is Bachelor of Arts for third year, subject Psychology, paper title Understanding Psychological Disorders. Title of the unit Disorders of Anxiety and Mood. Module name Obsessive Compulsive Disorder Clinical Picture. Module number 14. I am Father Geronimo de Silva, Assistant Professor, Department of Psychology, St. Xavier's College, Mapsa, Goa. Outline of the module: obsessive behavior, compulsive acts, types of obsessive thoughts, types of compulsive acts. What is expected from this module? Rather, the learning outcomes. Understanding of major concepts, obsession and compulsion, becoming aware of obsessive thoughts, controlling compulsive actions, and creating awareness of the disorder. Now let us try to understand what is obsessive compulsive disorder. Obsession involves persistent, recurrent, unwanted or intrusive thoughts, images, impulses that are experienced as disturbing, inappropriate, and uncontrollable, accompanied by compulsive behaviors. The person who is suffering from this disorder makes all attempt to suppress or ignore such thoughts with other thoughts and feels that the obsessional thoughts are his own products. What are compulsions? Compulsions are overt, repetitive behaviors or covert mental acts. My dear students, the common compulsive acts people often engage into: cleaning and checking. People feel compelled to perform the acts in order to reduce anxiety. As soon as the compulsive acts are performed, people feel nice because there is so much distress, and after performing these acts, they feel relieved. These acts significantly interfere with normal routine, occupational functioning, or social relationships. My dear students, individuals with obsessive compulsive disorder are preoccupied with details, rules, lists, order, organization, or schedules to the extent that the major point of the activity is lost. They show perfectionism that interfere with task completion. These people show rigidity and stubbornness and set overly strict standards for themselves. Excessively devoted to work and productivity, and because of which these people hardly have any free time or any relationship with their friends. They are so much occupied with these or any kind of work that they have no time for any other leisure. Such people are over-conscientious, scrupulous, and inflexible about matters of morality, ethics, or values. They are unable to discard worthless or worn out objects, even when they do not have any sentimental value. They are reluctant to delegate tasks to others or working with others unless they go along with their ways of doing things. Because they are so rigid in their thinking, So they expect people to follow their rules and regulation. Otherwise, they would find whatever work that is given to these people, that work will be incomplete. They also have a miserly way of spending money because they think money should be saved for future or in times of need. The prevalence of OCD among people, approximately 1% is found usually in late adolescence or adulthood. However, rare cases may be found in childhood with no gender differences. Obsessive compulsive disorder often occurs along with depression, generalized anxiety disorder, post-traumatic stress disorder, social phobia, dependent and avoidant personality disorder. My dear students, people with OCD are very much worried about two important words, namely, what if. These two words worry them so much that something bad may happen in their life. Now, let's look what are those obsessive thoughts that people are often worried about. Contamination of fears, harming oneself, need for symmetry, violence or aggression, or sexual obsession, religious thoughts. My dear students, just want to tell you a little more about contamination fears. These people are so much worried that something bad may happen to them. They are so much scared of that they continuously feel like something bad will happen to them. And that's why they have such negative thoughts. What are some of the compulsions that people with OCD engages into? Cleaning. Especially, they will keep cleaning their hands very often. They may just open the door and they find there is dirt on the knob of the door, so they would want to wash their hands. Repeated checking. These people constantly make sure their doors and their windows are closed. Even halfway, wherever they are going, they may come back to their homes only to make sure that everything is checked properly. Then repeating, ordering, arranging, counting, and washing rituals. Reference, in case if you want to study or read more in detail about OCD. Thank you.